If you only have 4 minutes, every second belongs to the truth, Dr. Daniel Brooks said as the emergency department doors burst open and a team of paramedics rushed a critically injured Navy SEAL into Trauma Bay 3. The entire room shifted instantly from routine efficiency to absolute focus. Heart monitors came alive, medical carts rolled into position, and experienced physicians surrounded the patient with the confidence that came from years of handling impossible situations. Emily Carter stood quietly near the edge of the room, holding an electronic chart against her navy blue scrubs. She had been working at St. Andrew Medical Center for only 2 weeks, making her the newest emergency room nurse on the team. Most of the staff barely knew her name. They knew only that she arrived early, left late, spoke very little, and never tried to draw attention to herself. "Emily, stay with documentation," one resident instructed without looking at her. "We already have enough hands in the room." She answered with a calm nod. Of course. There was no disappointment in her voice, no frustration, and certainly no argument. She stepped aside exactly where she had been told, opened the patient's chart, and quietly began recording information as the trauma team worked around her. Dr. Brooks directed every movement with remarkable precision. Years of experience had earned him the trust of every physician and nurse inside the department. His instructions were clear, confident, and immediate. Laboratory requests were placed. Imaging was prepared. Vital signs were announced across the room every few seconds. Everyone moved with purpose. Everyone except Emily, who appeared almost perfectly still. While others watched monitors and numbers, her attention remained fixed on the patient himself. She noticed the rhythm of each breath, the slight movement of one hand, the timing of every response that occurred between the electronic readings. Her eyes traveled slowly from the patient's face to his shoulders, then to the placement of the emergency equipment already surrounding him. She never interrupted anyone. She simply observed. A young resident glanced toward her and quietly whispered to another physician, "She looks completely overwhelmed." The second resident shrugged. "She is new. This kind of case is not something you forget." Emily heard neither comment, or if she did, she gave no sign of it. She continued watching the patient with extraordinary patience, almost as though she were waiting for someone to speak without using words. Another set of vital signs was called out. Dr. Brooks immediately adjusted the treatment plan according to the latest readings. Around him, every member of the team responded without hesitation. Emily lowered her eyes briefly to the chart before looking back at the patient once again. Something about the sequence did not feel right. The numbers appeared reasonable, but the patient did not. It was not a dramatic difference. In fact, most people would never have noticed it. Yet the quiet expression on Emily's face changed ever so slightly. She looked toward the large digital clock mounted above the trauma bay entrance. For minutes, that was the window everyone believed they had. She slowly set the electronic chart on a nearby counter and took one careful step closer. Nobody noticed. Every eye remained fixed on the monitors. Emily gently folded her hands behind her back, studying one final detail that seemed almost invisible beneath the organized urgency filling the room. Then, in a voice so calm it barely rose above the sound of the equipment, she spoke for the very first time since the patient had arrived. "Doctor," she said respectfully, looking directly at Dr. Brooks, "I think we are looking at the wrong problem." Dr. Daniel Brooks did not answer immediately. The confidence in Emily Carter's voice was so unexpected that it momentarily cut through the organized rhythm of the trauma bay. Every physician continued working, but several glanced toward the newest nurse with puzzled expressions. One resident quietly shook his head. "We already know what we are treating," he muttered. Emily remained completely composed. She neither defended herself nor repeated her statement. Instead, she took another careful look at the patient, paying almost no attention to the monitors that continued displaying an endless stream of numbers. She watched the patient's breathing, the subtle tension around his jaw, the position of one hand resting against the stretcher, and the timing between every visible response. None of those observations appeared dramatic on their own, yet together they painted a picture that refused to match the conclusion everyone else had already accepted. Dr. Brooks finally stepped toward her. His expression remained professional rather than irritated. "What are you seeing?" he asked. Emily answered softly enough that only those closest could hear. "The equipment is telling us one story. His body is telling another. A resident folded his arms. The monitors do not make mistakes. Emily acknowledged the comment with a slight nod. Neither does the human body. The room fell quiet for a brief moment before activity resumed. Dr. Brooks studied her face carefully. During 23 years in trauma medicine, he had learned to recognize confidence, fear, arrogance, and uncertainty. Emily displayed none of them. She simply appeared focused, almost as though she had encountered this exact pattern before. "Explain," he said. Emily stepped to the side of the stretcher without interfering with anyone else's work. "Please look at the sequence instead of the individual readings," she replied. "The numbers appear stable enough when viewed separately, but together they do not agree with what we are seeing." Dr. Brooks glanced from the monitors back to the patient. At first, nothing stood out. Then Emily quietly pointed toward a subtle physical response that had repeated itself 3 consecutive times. It was so small that several nurses admitted later they had never noticed it. "There," Emily said calmly. "That should not happen if our current assessment is correct." The chief surgeon narrowed his eyes. He looked again, this time ignoring the digital displays and focusing only on the patient. The unusual pattern became impossible to overlook once someone directed attention toward it. "Portable ultrasound," Dr. Brooks ordered. The request surprised everyone. A resident looked confused. "Doctor, that is not part of the standard sequence." Dr. Brooks never looked away from the patient. "Bring it anyway." Within seconds, a technician wheeled the machine beside the bed. Emily accepted the probe only after Dr. Brooks gave a slight nod granting permission. Her movements were measured, precise, and completely free of hesitation. She adjusted the angle only twice before quietly stopping. She did not announce what she had found. She simply turned the screen toward Dr. Brooks. His expression changed immediately. The finding was subtle but significant enough to alter the entire direction of treatment. "Change the plan," he said without delay. "We are addressing the wrong priority." Around the room, the staff moved quickly as new instructions replaced the previous ones. Nobody questioned the decision now. Emily stepped backward as soon as the revised treatment began, returning to the edge of the room exactly where she had started. She neither asked for recognition nor attempted to explain how she had noticed what everyone else had missed. She simply picked up the electronic chart again and resumed documenting the case. Less than 4 minutes after she had first spoken, the atmosphere inside the trauma bay began to change. The urgency remained, but the uncertainty slowly disappeared. Dr. Brooks looked across the room toward Emily one more time before quietly asking the question that no one else had yet dared to say aloud. "Where does a new emergency room nurse learn to see something like that?" Dr. Daniel Brooks held Emily Carter's gaze for several long seconds, searching for the slightest hint of uncertainty. He found none. Around them, the emergency department gradually settled into a steadier rhythm as the revised treatment continued producing the results everyone had hoped to see. One by one, the anxious expressions on the faces of the residents softened into cautious relief. The monitors now reflected what Emily had quietly recognized before anyone else. A nurse standing beside the portable ultrasound looked back at Emily with open curiosity. "How did you know to check there?" she asked. Emily placed the electronic chart on the counter before answering. "I did not know," she replied gently. "I noticed something that did not belong, so I kept looking until the pieces made sense." The simplicity of her explanation somehow made it even more remarkable. Dr. Brooks stepped closer. Most people would have trusted the first impression. Emily smiled politely. "First impressions are valuable, doctor. They simply should not become the final answer too quickly." Those words lingered in the room long after she finished speaking. Several residents exchanged thoughtful glances, realizing they had become so focused on following established procedures that they had stopped questioning whether every detail truly fit together. Dr. Brooks looked toward the patient once more before removing his gloves. "Excellent work, everyone," he said to the team. "Prepare for transfer." As nurses organized equipment and completed documentation, Emily quietly returned every instrument she had used to its proper place. She cleaned the ultrasound probe, checked the battery level before returning it to the technician, and neatly arranged the supplies exactly as she had found them. Nothing about her behavior suggested she believed she had done anything extraordinary. She simply moved on to the next task. One of the younger residents approached her with genuine curiosity. "Emily," he said, Have you always worked in emergency medicine? She looked up briefly. Most of my career has involved patients who needed careful observation. Where? He asked. Emily paused just long enough to choose her words. Different places at different times. The resident laughed softly. That sounds mysterious. Emily answered with a small smile. It is much less interesting than it sounds. Before the conversation could continue, a hospital administrator entered the trauma bay carrying a tablet. She walked directly to Dr. Brooks and quietly whispered something that immediately changed his expression. Are they here already? He asked. The administrator nodded. They arrived 5 minutes ago. Dr. Brooks glanced toward the patient, then toward Emily. Who is here? He asked. 2 federal agents. The administrator replied. Hospital security escorted them to conference room B. They asked specifically for the nurse who participated in this case. The surrounding conversation stopped almost instantly. Several staff members looked toward Emily with visible confusion. One resident quietly muttered, "Federal agents?" Another nurse whispered, "Did something happen with the patient?" The administrator shook her head. They were very clear. They are not here about the patient. They requested a meeting with Nurse Emily Carter. Emily remained remarkably calm, showing no surprise beyond a single thoughtful blink. Dr. Brooks noticed her reaction immediately. Have you met them before? He asked. Emily slowly shook her head. Not that I remember. The chief surgeon studied her face carefully. Every instinct he had developed over decades told him she was telling the truth, yet nothing about the morning made ordinary explanations seem sufficient anymore. He nodded toward the hallway. Then let us find out why 2 federal agents came looking for the quietest nurse in my emergency department. Emily picked up her identification badge from the counter, straightened the sleeve of her navy scrub top, and followed him out of the trauma bay with the same calm, measured pace she had maintained since the beginning of the day, while behind them an entire emergency department watched in complete silence, each person wondering the very same question that had just begun to occupy Dr. Brooks's mind. Who exactly was Emily Carter? Conference room B was quiet enough that the faint hum of the hospital ventilation system seemed unusually loud. 2 men in dark business suits stood beside the table, each wearing a simple identification badge clipped neatly to a jacket pocket. Neither appeared impatient, and neither displayed the urgency that had filled the trauma bay only minutes earlier. They waited calmly as Dr. Daniel Brooks opened the door and stepped inside with Emily Carter following a few feet behind. The older agent offered a polite nod. Dr. Brooks. Miss Carter, thank you for meeting with us. Dr. Brooks motioned toward the chairs. I understand you requested to speak with my nurse. That is correct, the older agent replied. Emily quietly took a seat without asking a single question. She folded her hands together on the table and looked at both men with the same composed expression she had maintained throughout the morning. The younger agent noticed it immediately. You seem remarkably calm. Emily smiled faintly. Hospitals are good places to learn perspective. The older agent returned the smile before placing a slim folder onto the polished table. First, let me reassure both of you. We are not conducting a criminal investigation. Nobody here has done anything wrong. Dr. Brooks leaned forward slightly. Then why involve federal agents? Because today's case generated an automatic notification through a military liaison assigned to the patient. The room became noticeably quieter. Whenever certain active duty personnel receive emergency treatment, unusual circumstances can trigger a routine review. That is exactly what happened today. Dr. Brooks glanced toward Emily. And what was considered unusual? The younger agent answered without hesitation. The medical sequence performed before the patient's condition stabilized. Emily remained silent. Specifically, he continued, the order in which Miss Carter evaluated the patient before recommending a change in assessment. Dr. Brooks frowned. She recognized a subtle pattern. That is called good nursing. We agree, the older agent replied. Our question is not whether she made the correct decision. Our question is how she recognized that specific sequence so quickly. Emily finally spoke. Observation improves with experience. Normally, yes, the older agent answered respectfully. However, the observational method you demonstrated follows a structured approach that is not taught in civilian emergency medicine. Dr. Brooks looked back and forth between them. What exactly are you saying? The younger agent opened the folder and carefully removed several printed diagrams. They were simple illustrations showing patient assessment pathways without any classified markings visible. These represent a specialized medical observation framework developed for teams expected to operate with limited resources under extreme conditions. It emphasizes reading the patient before trusting the equipment. Miss Carter followed that framework almost step for step. Emily glanced briefly at the diagrams before looking back at the agents. Medical principles often overlap. Some do, the older agent acknowledged. This one rarely appears outside a very small professional community. Dr. Brooks studied Emily again. She showed no sign of surprise, no attempt to deny anything, and no effort to explain herself. Instead, she simply listened. Miss Carter, the younger agent asked gently, where did you first learn to observe patients that way? Emily paused for several seconds before answering. From people who believed every detail mattered because someone else's tomorrow depended on today's decisions. The older agent slowly closed the folder without taking his eyes off her. That answer, he said quietly, is almost identical to the opening principle of a federal medical training program that officially ended years ago. Dr. Brooks felt the room grow even quieter. The pieces no longer seemed random. Emily had recognized a pattern no ordinary emergency nurse should have known. She had remained calm under extraordinary pressure, and now two federal agents were speaking to her with unmistakable professional respect rather than suspicion. The older agent rested one hand lightly on the closed folder before asking the question that would change the entire conversation. Miss Carter, have you ever served as an instructor for a government medical training program? Emily Carter did not answer the question immediately. She looked at the closed folder resting on the conference table, then at the two federal agents sitting across from her. Her expression remained calm, neither defensive nor surprised. Dr. Daniel Brooks noticed the silence, but chose not to interrupt it. Over the past hour, he had watched Emily make one impossible observation after another without ever trying to impress anyone. Whatever answer she was about to give, he sensed it would explain far more than the events inside the trauma bay. Emily finally spoke in the same quiet voice that had become impossible to ignore. There was a period of my career when I helped teach medical observation. The younger agent nodded slowly. For whom? Emily offered a faint smile. People whose work demanded good decisions when technology could not answer every question. The older agent carefully opened the folder once more. This time he removed a single document printed on plain white paper. No dramatic markings appeared on the page. Only a government seal at the top and several lines of administrative text. He slid it gently across the table until it rested in front of Emily. We requested authorization to verify a historical personnel record after today's incident, he explained. The request returned exactly one archived match. Dr. Brooks glanced at the document, but could not read it from where he sat. What does it say? The older agent answered without hesitation. Approximately 9 years ago, Emily Grace Carter served as a combat medical instructor within a specialized federal training program supporting selected military personnel. Her civilian nursing license remained active after her government assignment concluded, but the operational details of her service were administratively archived. The room became completely still. Dr. Brooks slowly looked toward Emily. She neither confirmed nor denied the statement. Instead, she quietly folded her hands together. I have not thought about those years in a long time, she admitted. The younger agent smiled respectfully. Most people from that program continued into consulting, leadership, or federal advisory positions. You did something different. Emily nodded. I returned to nursing. Dr. Brooks frowned with genuine curiosity. After training highly specialized teams, why would you choose to become an emergency room nurse again? Emily looked toward the conference room window where hospital staff moved through the hallway outside, answering call lights, comforting families, and preparing rooms for the next patients. Because the work never changed, she answered. Only the uniforms did. Nobody spoke for several moments. The simplicity of her response carried more weight than any official record could have provided. The older agent quietly closed the folder. Our records describe you as an exceptional instructor, he said. Former trainees consistently mentioned one lesson above every other. Emily tilted her head slightly. Which lesson? Observe the person before you observe the equipment. Machines provide information. People reveal the truth. Dr. Brooks lowered his eyes for a moment. remembering exactly how Emily had stood silently beside the trauma bed while everyone else focused on the monitors. Suddenly, every decision she had made that morning made perfect sense. She had not relied on instinct alone. She had followed years of disciplined training built around patient observation rather than immediate assumptions. Before anyone could continue, there was a gentle knock on the conference room door. A hospital staff member stepped inside. "Dr. Brooks," she said quietly, "the patient from Trauma Bay 3 has regained consciousness. He is stable, and he has asked if the nurse who helped him is still here." Emily looked up for the first time since entering the room. The two agents exchanged a brief glance, and the older one smiled almost knowingly. "Perhaps," he said softly, "the next part of this story should come from someone who remembers exactly where he learned to recognize your way of thinking." Emily Carter quietly stood from her chair without saying a word. Dr. Daniel Brooks followed beside her while the two federal agents remained in the conference room, neither attempting to stop them. As they reached the recovery wing, the atmosphere felt remarkably different from the urgency that had filled the emergency department earlier that morning. The steady rhythm of medical equipment had replaced the frantic pace of the trauma bay, and soft afternoon light filtered through the large hospital windows. Outside one recovery room, a nurse smiled reassuringly before opening the door. "He has been asking for you," she said. Emily nodded politely and stepped inside. The Navy SEAL rested comfortably against the raised hospital bed, his condition noticeably improved. He slowly turned his head toward the doorway, studying Emily for several seconds before a faint smile appeared across his face. "I knew it was you," he said quietly. Dr. Brooks stopped walking. "You recognize her?" The patient gave a small nod. "Not by her name." His eyes never left Emily. "By the way she looked at me before she looked at the monitors." The room fell completely silent. Emily returned the smile with gentle warmth, but said nothing. The patient continued. "Years ago, one instructor repeated the same lesson at the beginning of every medical exercise. She told us that machines could confirm what we already suspected, but only careful observation could teach us what we had not yet discovered." Dr. Brooks slowly looked toward Emily, realizing he was hearing the very same philosophy she had demonstrated only hours earlier. "That instructor was you," he said softly. Emily answered with quiet honesty. "I was one of many people who tried to prepare others to make good decisions." The patient shook his head. "No, ma'am. There were many instructors. Only one taught us to slow down before rushing toward the obvious answer." His words carried no drama, only sincere gratitude. That lesson stayed with me. Emily stepped a little closer to the bedside. "Then you remembered the important part." The patient smiled. "I remembered because you repeated it until nobody could forget." Dr. Brooks found himself reflecting on every assumption he had made about Emily since her first day at the hospital. He had seen a quiet new nurse who rarely spoke during rounds, never realizing that silence had been shaped by years of teaching others under circumstances far more demanding than anything inside his emergency department. The two federal agents entered the room a moment later, but remained respectfully near the doorway. The older agent spoke first. "Miss Carter, our responsibility was simply to verify the historical record. We appreciate your time." Emily inclined her head politely. "Thank you." The younger agent smiled. "Your record may have been archived, but your influence clearly was not." The patient looked toward Dr. Brooks. "Doctor, you have someone extraordinary on your team." Dr. Brooks answered without hesitation. "I know that now." As everyone quietly left the recovery room, he walked beside Emily through the hallway. "When this shift is over," he said, "I would like your help developing a new observation workshop for every physician, nurse, and resident in this department." Emily looked at him with the same calm expression she had worn since the beginning of the day. "If it helps even one patient, I would be honored." Dr. Brooks smiled. "I think it will help every patient." A call light sounded from another room at the far end of the hallway. Emily immediately turned toward it, gently adjusting her identification badge as she walked. She did not pause to think about archived records, federal agents, or forgotten titles. Another patient needed care, and that had always mattered more to her than anything written inside a government file. Quietly, without seeking recognition, she stepped into the next room and began again. The rest of the afternoon passed with the familiar rhythm that only a busy emergency department could create. Ambulances continued arriving. Families waited anxiously for updates. Physicians moved from room to room, and nurses quietly carried out hundreds of small tasks that rarely drew anyone's attention. Emily Carter returned to her regular assignment without mentioning the conversation with the federal agents or the recognition she had received from the recovering Navy SEAL. She updated patient charts, answered call lights, adjusted blankets, reassured worried families, and checked medications with the same quiet discipline she had shown since her first day at St. Andrew Medical Center. Nothing about her routine suggested that only hours earlier a hidden chapter of her life had unexpectedly resurfaced. Yet the people around her had changed. A resident who had dismissed her opinion that morning now paused before finalizing every patient assessment, asking himself whether he had overlooked anything. A veteran nurse found herself paying closer attention to subtle changes in a patient's expression before reading the monitor. Even the technicians began slowing down long enough to observe the people connected to the equipment instead of focusing only on the numbers displayed across the screens. Dr. Daniel Brooks watched these small changes from the central workstation with quiet satisfaction. He realized that Emily had done something no lecture, conference, or textbook had accomplished in years. She had reminded an entire department that medicine began with observation, not technology. Near the end of the shift, he approached Emily while she organized supplies inside the trauma room. "I have been thinking about something," he said. Emily looked up with a polite smile. "Yes, doctor." He rested one hand lightly against the counter. "When you first arrived here, I assumed your silence came from inexperience." Emily waited patiently. "Now I realize it came from confidence." She shook her head gently. "Not confidence." Dr. Brooks looked puzzled. "Then what?" Emily carefully placed a package of sterile gloves into the cabinet before answering. "Perspective. The patient has never benefited from my opinion of myself. The patient only benefits from my attention." Dr. Brooks smiled slowly. "I suspect that is why people remember your teaching years later." Emily looked toward the busy hallway outside the trauma room. "If they remember anything, I hope it is that every person deserves the same level of care, whether anyone knows their story or not." Before he could reply, one of the younger residents approached carrying a patient chart. He hesitated for a moment before speaking. "Emily, would you mind looking at something with me?" She accepted the chart without hesitation. Together, they walked into an examination room where an elderly patient waited comfortably on the bed. The resident explained his observations while Emily listened carefully without interrupting. Instead of immediately offering an answer, she asked several thoughtful questions that encouraged him to reconsider his own assessment. After another careful examination, the resident quietly smiled. "I almost missed that." Emily nodded warmly. "Most important details are patient enough to wait until we notice them." As they stepped back into the hallway, the resident thanked her sincerely. Dr. Brooks observed the exchange from a distance and realized that Emily had already begun teaching again, exactly as she claimed she would. She needed no classroom, no official title, and no audience. Her lessons appeared naturally through ordinary moments, changing the way people thought one careful conversation at a time. Watching her walk toward the next patient with the same calm expression she had carried throughout the day, Dr. Brooks finally understood that true leadership rarely announced itself. It simply raised the standard so quietly that everyone else eventually found themselves following it without ever being asked. Morning arrived quietly at St. Andrew Medical Center the following week, but the atmosphere inside the emergency department no longer felt quite the same. The routines remained unchanged. Ambulances still arrived without warning. Physicians still reviewed charts between patients. Nurses still hurried through hallways carrying medications and supplies. Yet beneath the familiar pace, there was a noticeable difference in the way people worked together. Residents no longer dismissed questions from the newest members of the team. Nurses felt more comfortable sharing subtle observations before conclusions had been reached. Even the conversations during morning rounds had become slower, more thoughtful, and more collaborative. Emily Carter noticed the change, but never mentioned it. She simply continued doing what she had always done. Before the first patient of the day arrived, she carefully inspected emergency equipment, verified medications, checked every trauma card, and quietly greeted each member of the staff with the same warm professionalism that had become part of her routine. Dr. Daniel Brooks watched from across the department with a quiet sense of admiration. For years, he had believed that leadership depended on experience, authority, and decisive action. Emily had shown him another kind of leadership entirely, one built on humility, consistency, and careful attention to the smallest details. During the afternoon, he gathered the physicians, residents, nurses, and technicians for a brief departmental meeting. Everyone expected another discussion about procedures or scheduling. Instead, Dr. Brooks looked around the room before speaking in a calm, measured voice. Last week reminded me that knowledge alone is never enough. Experience matters, but curiosity matters just as much. We become better caregivers when we continue observing instead of assuming. Several staff members nodded in agreement. He continued, beginning next month, our department will introduce a new observation workshop focused on recognizing subtle patient changes before relying entirely on technology. The curriculum will be developed with assistance from one of our own colleagues. Every eye turned toward Emily. She looked genuinely surprised and immediately shook her head slightly. Doctor, this should belong to the entire team, she said quietly. Dr. Brooks smiled. Exactly. That is why you are the right person to help build it. Gentle laughter spread through the room, followed by warm applause that lasted only a few seconds but carried sincere respect. Emily accepted the recognition with the same humility she had shown from the beginning. If we can help even one person receive better care, she replied softly, then every lesson is worth sharing. Later that afternoon, the young resident who had once dismissed her observations approached with a small notebook in his hand. I started writing down the details I usually overlook, he admitted. You were right. The patients tell us much more than the monitors do. Emily smiled kindly. The monitors are important. They simply become more valuable after we understand the person standing in front of us. The resident nodded thoughtfully before returning to his patients. Across the department, Dr. Brooks quietly watched the exchange. He realized that respect had not arrived because anyone had learned about Emily's past. Respect had grown because they had witnessed her character every single day. The government records, the federal agents, and the archived history had answered questions, but none of those things explained why people trusted her now. Trust had been earned through patience, compassion, and consistency. As another patient entered the emergency department, Emily calmly picked up a fresh pair of gloves and walked toward the treatment room without hesitation. Several members of the team instinctively followed her lead, not because of a forgotten title from years ago, but because they had learned that the quietest voice in the room sometimes carried the clearest understanding of what truly mattered. Several months passed, and the story of one remarkable morning quietly settled into the rhythm of everyday life at St. Andrew Medical Center. New employees joined the emergency department without ever hearing the full details. Patients continued arriving at every hour of the day and night, each carrying a different worry, a different diagnosis, and a different hope that someone inside those hospital walls would know how to help them. Emily Carter never mentioned the federal agents, the archived records, or the specialized training that had once shaped her career. She never displayed certificates, corrected assumptions about her past, or asked anyone to recognize what she had done before becoming an emergency room nurse. Instead, she continued arriving before sunrise, checking every emergency card, confirming every medication, greeting every coworker with quiet kindness, and treating each patient with the same steady attention regardless of age, occupation, or background. Dr. Daniel Brooks often found himself remembering the first morning they had worked together. He could still hear Emily calmly saying that they were looking at the wrong problem. At the time, he had seen only a new nurse speaking carefully to a senior physician. Now he understood that true experience rarely announced itself through confidence alone. It revealed itself through discipline, humility, and the courage to remain observant when everyone else believed the answer had already been found. One evening, after the emergency department had finally grown unusually quiet, Dr. Brooks walked past the observation workshop classroom. Through the glass window, he saw Emily standing beside a small group of nurses and residents. There were no dramatic presentations, no complicated diagrams, and no stories about her own past. She simply placed a patient chart on the table and asked a single question. Before you read the numbers, what do you notice about the person? The room became silent as everyone looked more carefully than they had before. Dr. Brooks smiled to himself and continued walking. He realized that the greatest lesson Emily had ever shared was not hidden inside any government file, or preserved in any federal archive. It lived in the habits she practiced every single day and in the people who quietly became better caregivers because they had worked beside her. As another ambulance arrived outside, the emergency department came alive once again. Nurses moved with confidence, physicians prepared treatment rooms, and residents began their assessments with one important difference. Before turning toward the monitors, many of them now looked first at the patient, just as Emily had taught them through her actions rather than her words. Emily adjusted a fresh pair of gloves, smiled reassuringly at the next patient entering the trauma bay, and gently introduced herself exactly as she always did. Nothing about her manner suggested she had once trained elite professionals or advised specialized teams. She was simply the nurse standing beside someone who needed help. Dr. Brooks watched from across the room,